So today we're going to discuss about marasmus and kwashiorkor. So we're going to discuss about marasmus and kwashiorkor, and then we're going to discuss about uh, neonatal reflexes which are present during the neonatal period reflexes, and then we're going to see about caput succedaneum and cephal hematoma, and we're going to see about seizures and seizures and Wilms tumor. Wilms tumor is the most common tumor of children kidney, most common tumor of kidney in children, which is also known as nephroblastoma. Tumors of the kidney, pediatrics, 95% Wilms tumor, and most in less than 5 years, but rare less than 6 months. 4 to 5% is mesoblastic nephroma, most common kidney tumor in newborn. So Wilms tumor we're going to discuss, and then we're going to discuss about the tumors of neonatal period and the symptoms of them, and then we're going to see about cerebral palsy, and then we're going to see about epilepsy and their drug of choice. So first we're going to see about what are seizures. What are seizures? Seizures associated with high fever in an otherwise neurologically normal child, 6 months to 5 years. Seizures. Seizures associated with with high fever, high fever, high fever in a neurologically in a neurologically logically neurologically 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 normal child, in a neurologically normal child. Seizures associated with high fever in a neurologically normal child, and this period is from 6 months to 5 years of age. This happens during 6 months to 5 middle age. What is uh, these are divided into simple febrile seizures versus complex febrile seizures. These are divided into two types: simple and complex febrile, febrile, bone, febrile, febrile seizures. And what is simple febrile seizures? What is simple febrile seizure? What is simple febrile seizure? Simple febrile seizure is nothing but duration. Here the duration is less than 15 minutes. Here the duration is more than 15 minutes. Here the duration is less than 15 minutes. The duration is more than 15 minutes. Single seizure in 24 hours of fever. In single seizure in 24 hours. Single seizures in 24 hours of fever. Multiple seizures within 24 hours of fever. Multiple seizures within 24 hours. And next is these are generalized. These are generalized throughout the body, and these are focal. These are focal. Risk factors of development of epilepsy is complex febrile seizures and and family history of epilepsy, and delayed in development. Risk factors of development of epilepsy is nothing but complex cerebral seizures, family history of epilepsy, and delay development. And the risk factors are, what are the risk factors? The risk factors are complex complex febrile seizures, and family history of epilepsy, and next is the delay in development. Delay in delay development. Delay delay in development. And these are in, so we should give intermittent prophylaxis with clozapam and diazepam if more than 3 seizures per 6 months, for 6 months, or 4 seizures for 1 year. So we have to introduce intermittent prophylaxis prophylaxis with with either clobazam or diazepam diazepam if more than 3 seizures per 6 months, or more than or equal to 4 seizures per 1 year. Okay, and present with febrile seizure, the treatment is IV lorazepam, to prevent febrile seizures. To prevent febrile seizures, febrile seizures, we should we should avoid the fever. The fever is the triggering point for the mm, seizures. So we should stop the seizure fever by simply giving paracetamol. Paracetamol. And next is the infantile spasms. Next is the infantile spasms. And next is the infantile spasms. So infantile spasms is also known as West syndrome. There is a connectivity issues. I think so. I think so. Mm. Hello, can you hear me? Hello, you going to live now? Is my voice audible? Hello, we are going live now. Is my voice audible? Hello, we are going live now. Is my voice audible? So we are discussing about absence seizures. Absence seizures is also known as petit mal epilepsy. That is sudden interruption in the activity of the new. And next we're going to see about infantile spasms. Second about seizure is the infantile spasm. Infantile infantile seizure is also known as West syndrome, and this is also known. So it is a combination. So infantile spasm is also known as infantile spasm. Infantile spasm is also known as waist syndrome. It is a combination of dis it's a combination of infantile spasm is also known as West syndrome. It is a combination of epileptic. It's a combination of. It's a combination of. So it is a combination of. It is a combination of. It's a combination of epileptic spasms, epileptic spasms plus developmental regression, developmental developmental regression, and and here the delay in the milestone is noted. Delay in the milestones is noted. Milestones are delayed. Milestones are delayed in the infantile spasms, and the most characteristic EEG is and the characteristic EEG is hips arrhythmia. What is hips arrhythmia? It's nothing but disorganized rhythm. Hips arrhythmia. Hips arrhythmia. Arrhythmia. Hips arrhythmia is nothing but a disorganized rhythm. So in the EEG you can see a disorganized rhythm like this disorganized rhythm, and it is usually disorganized rhythm, and it is usually associated with poor prognosis, poor prognosis, and which is very difficult to treat. Drugs we give is ACTH injection. Injection ACTH injection is the drug of choice for 4 weeks. For 4 weeks, we give and or we give oral anti-epileptics like vigabatrin or prednisolone, or we give vigabatrin oral anti-epileptics like vigabatrin and predni prednisolone 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 prednisolone. And next is the juvenile myoclonic epilepsy. Third one is the juvenile 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 myoclonic myoclonic epilepsy. Juvenile myoclonic epilepsy occurs in adolescence. Occurs in the adolescence. Occurs in adolescence. Occurs in adolescence. Occurs in adolescence. Occurs in adolescence. And maybe 20 to 20 and 30 years of age are the most common people. Maybe 20 to 30 years of age may be the mostly affected. The characteristic features are early morning myoclonic jerks. Characteristic CF is characteristic features. We all know that characteristic features you can see early morning. You can see early morning. You can see early morning, early morning, early morning myoclonic jerks leading to things dropping from hand. Early morning myoclonic jerks. What is myo? Myo means muscle. What is clonic? Clonic means rhythm. Jerks leading to things dropping from hand. Myoclonic jerks leading to leading to leading to things dropping from hand. Things dropping from dropping from hand. Okay, things dropping from hand. And the drug of choice is sodium sodium valproate. Sodium valproate will control, and it will be used for lifelong, and it is good prognosis is noted. So it is good prognosis. You can use it for good prognosis, and you can use it for lifelong or lifetime. And next is the Lennox-Gastaut syndrome, which usually affects the children. So next is the Lennox-Gastaut syndrome. Next is the Lennox-Gastaut Lennox-Gastaut syndrome, which usually affects the children between 2 to 10 years. 2 to 10 years. And you can see in mixed seizures, you can see both the myoclonic as well as the combination of seizures. You can see the combination of seizures. You can see combination of seizures in the Lennox-Gastaut syndrome. So it is given the name of mixed seizures. Mixed seizures, and plus cognitive impairment is also seen. So here the Lennox-Gastaut syndrome is cognitive impairment also seen. Cognitive impairment also seen in the patient. Impairment is also seen in the Lennox-Gastaut syndrome. And in the EEG, you can see here, in the EEG, which is a brain scan, you can see a slow wave EEG, which is a slow wave less than 3 Hz spike plus wavy. And the drug use is valproate does not. Valproate is used, sodium valproate. Valproate is used. If sodium valproate does not use, then use. If if not then use lamotrigine. Lamotrigine. Sometimes we use both. Okay. And next is the neonatal seizures. Neonatal seizures, the seizures that happen during the neonatal period. Neonatal seizures. Neonatal seizures. Neonatal seizures. And neonatal seizures are which will cause due to hypoxia and hypoglycemia. And next one is the hypocalcemia. Hypocalcemia. And next is the hemorrhage in brain. Next is the hemorrhage in brain. And here the drug of choice is IV phenobarbital. IV phenobarbital. IV phenobarbital. And next is we're going to see about the meningitis. So meningitis is nothing but meningitis in newborn, which causes during 0 to 2 months in the neonates. So group B streptococcus is the most common in worldwide. So we're going to see about meningitis. Meningitis. 0 to 2 months. 0 to 2 months affects the neonates. It affects the neonates. And you know that group B streptococcus. Which is also known as group B streptococcus, which is the most common in worldwide, worldwide, and in India, it is E. coli. In India, it is E. coli, and you know that Klebsiella, staph, and Listeria, which also causes in the worldwide, and 2 months to 2 years. 2 months to 2 years, the H. influenza and Streptococcus pneumonia, which is most commonly affected. H. influenza, and Streptococcus, Streptococcus pneumonia, which usually causes this. And you can see the most common complication of bacterial meningitis is in children is after 2 years. I forgot to tell you, after 2 years, after 2 years, after 2 years, Streptococcus pneumonia and meningococcus is the most common bacteria which comes during after 2 years of age. Streptococcus, 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 Streptococcus pneumonia, pneumonia, and and meningococcus and meningococcus is the most common causes, most common causes, most common causes during the second after second year of life. And the most common complication, most common MC is most common. Okay, most common complications of bacterial meningitis in children is of bacterial meningitis in children is of bacterial meningitis in children is in children in children in children is sensory neural deafness, sensory sensorineural sensory neural deafness, and which is diagnosed by which is diagnosed by AABR, which is auditory automated auditory brainstem response, and BERA. What is BERA? Brainstem evoked response audiometry. And the treatment of meningitis. Now we are going to see about the treatment of, and all children should be screened for deafness. All children should be should be should be screened for screened for screened for screened for deafness. You know, all children should be screened for deafness. Deafness, and the treatment is and for the treatment. So what is the cause? Which bacteria is going to cause? And we're going to treat according to the bacteria. And antibiotic duration, antibiotic duration, antibiotic duration, and prophylaxis, for the households, prophylaxis, prophylaxis households, 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 and meningococcus. We all know meningococcus, meningococcus is 5 to 7 days, and we should give prophylaxis for, yes, we have to give uh, prophylaxis for all households staying in that house. We have to give rifampicin, rifampicin. So rifampicin, and H influenza. Next one is the H influenza. So the antibiotic H influenza, then the H influenza, we are going to give 7 to 10 days of antibiotic duration, and it is oral. And some cases we give rifampicin for 2 days, and streptococcus pneumonia give 10 to 14 days of antibiotic duration, and there is no prophylaxis for the households. And some numbers, so we go to children less than 4 years unimmunized and immunocompromised children within same family. Okay. Okay.